What is Alzheimer's disease? Alzheimer's disease is a progressive and irreversible brain disorder that affects memory, thinking, and behavior. It is the most common cause of dementia in older adults, and it typically worsens over time. The exact cause of Alzheimer's disease is not fully understood, but it is believed to be caused by a combination of genetic, environmental, and lifestyle factors. Symptoms of Alzheimer's disease typically begin with mild memory loss and difficulty performing daily tasks, but as the disease progresses, individuals may experience more severe memory loss, confusion, disorientation, mood swings, and behavioral changes. Currently, there is no cure for Alzheimer's disease, but there are treatments available that can help manage symptoms and improve quality of life for individuals with the disease. Symptoms of Alzheimer's disease. Alzheimer's disease is a progressive neurological disorder that affects the brain's ability to think, reason, and remember. Here are common symptoms of Alzheimer's disease. 1. Memory loss. Difficulty remembering new information or recent events is one of the most common symptoms of Alzheimer's disease. The person may also forget important dates or names. 2. Language problems. Individuals with Alzheimer's disease may have trouble finding the right words or completing sentences. They may also struggle to understand what others are saying. 3. Disorientation. Confusion about time, place, or identity can occur. A person with Alzheimer's may get lost in familiar places, forget where they are, or how they got there. 4. Poor judgment. The person with Alzheimer's may make poor decisions, such as giving away large sum of money or falling prey to scams. 5. Changes in mood or behavior. People with Alzheimer's may become irritable, anxious, or depressed. They may also become more easily agitated or aggressive. 6. Misplacing items. Alzheimer's can cause a person to lose things or put them in unusual places. 7. Problems with abstract thinking. People with Alzheimer's may have difficulty with tasks that require abstract thinking, such as balancing a checkbook or understanding complex instructions. 8. Difficulty with daily tasks. Alzheimer's can make simple tasks such as dressing, bathing, and grooming difficult to perform. 9. Changes in personality. Alzheimer's can cause a person's personality to change over time, with individuals becoming more withdrawn or less interested in social interactions. 10. Loss of initiative. Individuals with Alzheimer's may lose interest in activities they once enjoyed, and may struggle to initiate new activities or hobbies. Reason of Alzheimer's disease. The exact cause of Alzheimer's disease is not fully understood, but researchers have identified several risk factors that may increase the likelihood of developing the disease. Here are 10 potential reasons for Alzheimer's disease. Two. Genetics. Family history of Alzheimer's disease and certain genetic mutations have been linked to an increased risk of developing the disease. 3. Lifestyle factors. Poor diet, lack of exercise, and smoking have been associated with an increased risk of Alzheimer's disease. 4. Cardiovascular health. High blood pressure, high cholesterol, and other cardiovascular risk factors may increase the risk of Alzheimer's disease. 5. Head trauma. A history of head trauma, particularly repeated head injuries, may increase the risk of Alzheimer's disease. 6. Chronic inflammation. Chronic inflammation throughout the body has been linked to an increased risk of Alzheimer's disease. 7. Sleep disturbances. Sleep disturbances and disorders, such as sleep apnea, have been linked to an increased risk of Alzheimer's disease. 8. Diabetes. Type 2 diabetes may increase the risk of developing Alzheimer's disease. 9. Environmental toxins. Exposure to certain environmental toxins, such as pesticides and heavy metals, may increase the risk of Alzheimer's disease. 10. Chronic stress. Chronic stress may increase the risk of developing Alzheimer's disease, as well as other health problems. It's important to note that while these factors may increase the risk of Alzheimer's disease, not everyone who has these risk factors will develop the disease. Additionally, there may be other risk factors that have not yet been identified. Treatment of Alzheimer's disease. There is no cure for Alzheimer's disease, but there are several treatments available that can help manage symptoms and improve quality of life for individuals with the disease. Here are potential treatments for Alzheimer's disease. 1. Medications. Medications such as cholinesterase inhibitors and meantime can help improve cognitive function and manage behavioral symptoms in some individuals with Alzheimer's disease. 2. Occupational therapy. Occupational therapy can help individuals with Alzheimer's disease maintain their independence by teaching them strategies to cope with everyday tasks. 3. Speech therapy. Speech therapy can help individuals with Alzheimer's disease maintain their communication skills and overcome difficulties with speaking and swallowing. 4. Physical therapy. Physical therapy can help individuals with Alzheimer's disease maintain their physical function and reduce the risk of falls and other injuries. 5. Music therapy. Music therapy can help improve mood, reduce anxiety, and promote social interaction in individuals with Alzheimer's disease. 6. Art therapy. Art therapy can help individuals with Alzheimer's disease express themselves and communicate their emotions through creative expression. 7. Pet therapy. Pet therapy can help reduce anxiety, promote relaxation, and improve social interaction in individuals with Alzheimer's disease. 8. Cognitive training. Cognitive training programs can help improve cognitive function and delay cognitive decline in some individuals with Alzheimer's disease. 9. Exercise. Regular exercise can help improve physical and cognitive function, as well as reduce the risk of developing Alzheimer's disease. 10. Support groups. Support groups can provide emotional support and practical advice to individuals with Alzheimer's disease and their caregivers. It's important to note that not all of these treatments will be effective for every individual with Alzheimer's disease, and treatment plans should be tailored to the individual's specific needs and symptoms. Precaution of Alzheimer's disease. While there is no guaranteed way to prevent Alzheimer's disease, there are several lifestyle choices that may help reduce the risk of developing the disease. Here are potential precautions for Alzheimer's disease. 1. Exercise regularly. Regular physical exercise may help reduce the risk of developing Alzheimer's disease. 2. Eat a healthy diet. A healthy diet, including plenty of fruits, vegetables, whole grains, and lean proteins, may help reduce the risk of developing Alzheimer's disease. 3. Maintain a healthy weight. Being overweight or obese may increase the risk of developing Alzheimer's disease. 4. Manage chronic conditions. Managing chronic conditions such as diabetes, high blood pressure, and high cholesterol may help reduce the risk of developing Alzheimer's disease. 5. Challenge your brain. Engaging in mentally stimulating activities such as reading, playing games, and learning new skills may help reduce the risk of developing Alzheimer's disease. 6. Stay socially active. Staying socially active by socially active participating in social events and maintaining relationships with friends and family may help reduce the risk of developing Alzheimer's disease. 7. Get enough sleep. Chronic sleep deprivation may increase the risk of developing Alzheimer's disease. 8. Reduce stress. Chronic stress may increase the risk of developing Alzheimer's disease, so finding ways to manage stress, such as through meditation or relaxation techniques, may be helpful. 9. Protect your head. Protecting your head from injury, particularly from repeated head trauma, may help reduce the risk of developing Alzheimer's disease. 10. Avoid tobacco and excessive alcohol consumption. Smoking and excessive alcohol consumption may increase the risk of developing Alzheimer's disease, so avoiding or limiting these behaviors may be beneficial. It's important to note that while these precautions may help reduce the risk of developing Alzheimer's disease, they are not a guarantee, and some individuals with no apparent risk factors may still develop the disease. Medical information disclaimer. This video contains general medical information. The information in this video is only for educational purposes. The medical information is not advice and should not be treated as such. You must not rely on the information in our videos as an alternative to medical advice from your doctor or other professional healthcare provider. My channel Health Tips by Shah Ji provides valuable information on how to stay healthy and fit. You can learn about the latest health trends and tips to help you stay healthy. Health Tips by Shah Ji is the perfect resource for anyone looking to improve their overall health and well-being.